Your skin structures tip of the week. When you're treating pigmentation, don't just think, how do I lighten this spot? Think, why is pigment being created in the first place? Pigmentation is not random, it's a protective response. Melanin is the skin's armor. It helps absorb UV, reduce DNA damage, and neutralize free radicals. So when pigment shows up, your job isn't to attack the skin or erase pigment completely. Your job is to understand the trigger, calm the pathway, protect the skin, and guide it back toward balance. All that matters because a lot of pigment protocols fail when we only focus on exfoliation or brightening without addressing inflammation, UV exposure, visible light, hormones, heat, acne, or barrier damage. So before you reach for the strongest peel, the most aggressive retinoid, or every pigment inhibitor in the treatment room, pause and ask, what is keeping this melanocyte activated? That question will make you a better esthetician immediately.
Welcome back to the Skin Instructors. I'm Morgan.
And I'm Jolie. Today we are doing a deep dive into pigment correcting ingredients, which honestly is one of those topics that can feel really overwhelming because there are so many ingredients people talk about.
Yeah, absolutely. There's hydroquinone, tranexamic acid, kojic acid, arbutin, licorice root. It just keeps going on and on. It can feel like you need a chemistry degree just to build a brightening routine.
And then you add in melasma, PIH, sun damage, acne marks, deeper skin tones, so many other factors, and suddenly just use a brightening serum isn't enough.
Right. Yep. So, this episode, we're going to break down how pigment is made, where different ingredients work in that process, and how to think through brightening protocols in a way that actually makes sense.
And we want this to feel practical, not just ingredient memorization, because if you understand the melanogenesis pathway, you can understand why certain ingredients work better together, why timelines matter, and why sunscreen is not optional.
I can't wait. So let's start with the foundation. Pigment is not the enemy.
Yes, I think that's such an important mindset shift, especially in aesthetics. Melanin is protective, it's part of the skin's defense system.
Right. Yeah. Melanin is going to help protect the skin from UV damage, oxidative stress, and free radicals. So when the skin produces that pigment, it's often responding to something that it perceives as a threat.
And that threat could be UV exposure, visible light, heat, inflammation, acne trauma, hormonal triggers, or even a treatment that was just too aggressive for that person's skin.
And that's why the goal is not to completely erase pigment. The goal is balance. We want to calm that overactive pigment production while supporting healthy skin function and preventing the pigment from being constantly retriggered.
Yeah, because if that trigger is still there, the pigment's just going to keep coming back.
Exactly. Yeah, if you can use all the best brightening serums in the world, but if your client is not wearing SPF or is sitting in heat constantly, or even has active inflammation, picking at acne lesions, you're going to be fighting an uphill battle the entire time.
Yep. Absolutely. Okay, so let's explain melanogenesis in a way that doesn't sound like a textbook.
Yes, please.
Melanogenesis is the process of making melanin. Melanin is produced by melanocytes, which live in the basal layer of the epidermis. And what's interesting is that all skin types have about the same number of melanocytes. The difference in skin tone comes to the amount, type, size, and the distribution of melanin.
Exactly. Yeah, so melanocytes make melanin inside little pigment packages called melanosomes. And those melanosomes are then transferred to keratinocytes. And as the skin cells move upward, that pigment is going to become more visible at the surface. So if we think about pigment correction, there's a few different places we can intervene.
Yeah, we can reduce the signal that tells the melanocyte to make pigment. We can inhibit tyrosinase, which is the enzyme involved in melanin production. We can reduce inflammation and oxidative stress, and we can speed up cell turnover so existing pigment moves up and out more efficiently. And we can protect the skin so the melanocyte doesn't keep getting activated.
I love that breakdown. I think this is what estheticians really want to hear.
Yeah.
Brightening is not one action and it's not one ingredient. There's multiple steps to this. Pigment correction is about pathway management.
hmm
So before we get into ingredients, we have to talk about what shapes pigmentation.
hmm Genes, hormones, environmental exposure, inflammation, those all play a role.
Mhm.
Even other cells in the skin, like fibroblasts, endothelial cells, sebocytes, can influence melanocyte behavior.
Yeah, and this is why pigment can be so stubborn. It's not always just too much sun. Sometimes it's your hormones or
hmm
acne, heat.
hmm
Sometimes there's a vascular component, and sometimes it could be a damaged barrier.
And sometimes it's all of those things happening together, depending on the person, which is why melasma, especially, can be so frustrating for clients and providers.
Mhm.
With melasma, you have to think beyond just that pigment. You have to think about inflammation, the hormones, UV and visible light, and then heat and the reoccurrence of it.
Invisible light is huge, especially for darker Fitzpatrick types and anyone prone to melasma or PIH. That UVB causes burns and DNA damage, and UVA goes deeper and contributes to oxidative stress and collagen breakdown. Invisible light can also worsen hyperpigmentation.
hmm That's why tinted mineral SPF or formulas with the iron oxides are so important, because regular SPF is important, but for pigment prone clients, that visible light protection really does matter too.
Yeah, and this is one of those moments where client education is everything because if they're using all of the pigment correctors at night but skipping their sunscreen during the day, they're basically undoing that whole entire progress.
Mm.
So let's start with the gold standard when it comes to pigmentation correction, hydroquinone.
Yeah, hydroquinone or HQ is a skin lightening agent derived from phenol. It's commonly used in dermatology to treat different types of hyperpigmentation, including melasma, freckles, or liver spots, and then post inflammatory hyperpigmentation.
And the reason hydroquinone is so effective is because it works directly on the pigment production process. Hydroquinone inhibits tyrosinase, which is the enzyme needed to convert dopa into melanin. So basically, it helps slow down the creation of new pigmentation.
And from what we know, hydroquinone can reduce tyrosinase activity significantly, in some cases by as much as 90%. It may also affect melanosomes, which are those little pigment packages we talked about earlier. And then hydroquinone can degrade melanosomes and may be selectively toxic to melanocytes by altering the structure of their organelles. That can decrease melanosome production and increase melanosome breakdown.
But this is where client expectations are going to matter because hydroquinone does not instantly erase pigment. It mainly helps prevent the formation of new melanin. So the pigment that's already sitting in the skin still has to move up and out as the skin naturally renews itself.
hmm Exactly. As the skin cells mature, the melanin containing keratinocytes in the epidermis are shed and newer keratinocytes are formed with less pigment. That's why brightening's not immediate.
And that's such an important point for estheticians to explain. A client may start hydroquinone and think, why don't I see a difference in 3 days? But that's just not how skin works.
Yeah. Hydroquinone's also available in different vehicles like lotion, cream, liquid, or gel. Liquid and cream formulas are usually preferred because liquid and gels can apply unevenly, which is not ideal when you're trying to correct uneven pigment.
hmm
If a hydroquinone product oxidizes and turns brown, that means it has little to no activity left.
Yeah, that's a good thing to educate clients on because they may keep using an oxidized product and wonder why they're not seeing results. Now, hydroquinone can be very effective, but it's not meant to be used forever. And I think that's such a valuable piece that isn't often explained.
Mhm.
The recommended use is typically limited to about 4 to 5 month period. And darker Fitzpatrick clients should usually discontinue hydroquinone after that 4 month mark.
Mhm. And this is where the cycling becomes important because hydroquinone is commonly used in a correction phase and then
Mhm.
it's paused, followed by a maintenance plan using non-hydroquinone brighteners, antioxidants, and retinoids, barrier support, and then very strict SPF usage.
Yeah, because long-term or improper use can increase the risk of irritation,
Hmm.
rebound pigmentation, and even rare complications like exogenous ochronosis. And we also have to remember our scope of practice. So, prescription strength hydroquinone is a medical provider conversation. As estheticians, we can educate, support the protocol, watch for irritation, reinforce compliance, and make sure that the client understands sunscreen and maintenance.
And we should never position hydroquinone as a magic eraser because some people do have that difficult pigment.
Exactly. Yeah, it's a pigment suppressor. If the client keeps triggering pigment with UV exposure or visible light, even heat, acne inflammation, picking, or not wearing their sunscreen, that pigment's going to come back.
Especially with melasma. Melasma is difficult, so it's definitely managed, not cured. So hydroquinone can be a powerful tool, but it has to be used intentionally for the right client, for the right amount of time, with the right education. Next up, we have tranexamic acid.
I love talking about this. So,
Mhm.
tranexamic acid is one of my favorites because it's just a major ingredient in pigment conversations, especially with melasma.
Mhm. Tranexamic acid works a little differently than traditional tyrosinase inhibitors. It helps interfere with some of the inflammatory and vascular signaling that can contribute to melanocyte activation, which is why it can be really helpful for stubborn pigment like melasma. And it often has inflammatory and vascular components too.
Topical tranexamic acid can be a great option when you're doing your brightening routines because it tends to be really well tolerated by clients. You'll often see it paired with ingredients like niacinamide, kojic acid, vitamin C, or retinoids. And then there's also oral tranexamic acid, which is a prescription only and requires screening because it may not be appropriate for clients with certain clotting risk or medical histories or certain medications.
Mhm. So, for estheticians, the key is understanding the difference. Topical tranexamic acid can fit into home care recommendations depending on the product line and client's skin. Oral tranexamic acid is something that the client would discuss with a qualified medical provider like a dermatologist.
And client selection is really going to matter here. Someone with melasma that worsens with heat, sun, hormones, or visible light may benefit from tranexamic acid as part of a larger plan. But again, not by itself. It's not a use tranexamic acid and, and ignore everything else.
Right, never.
Let's move into some of the more common non hydroquinone brighteners like kojic acid, arbutin, and licorice root.
Yeah, kojic acid is a tyrosinase inhibitor. It can help reduce pigment production, but it can be irritating for some people, especially sensitive or compromised skin. Um, but it is really great for treating melasma because it has some anti-inflammatory benefits into it.
Yeah, I really like kojic acid, but I don't think it's always the gentlest option like
Hmm.
you mentioned. If someone already has barrier damage or reactive skin, it's not going to be my go-to. I'm going to be thoughtful about how many active ingredients at that point I'm layering with the other actives.
Arbutin is another tyrosinase inhibitor. It's often described as a gentler brightening ingredient, and it's commonly used in pigment-focused serums. And licorice root is interesting because it can help with brightening, but it can also have a soothing and anti-inflammatory benefits also.
Which makes it nice when pigment is connected to inflammation.
Mhm.
So think about your clients that have acne marks or redness prone skin,
Yeah.
or clients who can't tolerate a really aggressive pigment routine. This is going to be great for them. This is where I want estheticians to really think strategically. If your client has pigment plus sensitivity, don't just keep adding stronger inhibitors.
Mhm.
Think about calming, barrier support, and inflammation control ingredients.
Yeah, because inflammation is still a pigment trigger. So now let's talk about vitamin C.
Yeah, vitamin C is one of those ingredients that clients recognize, but they don't always understand what it's doing.
Hmm.
It supports pigment correction partly by helping reduce oxidative stress, and it can also support a brighter, more even looking complexion and works really well in daytime routines under your sunscreen.
And that antioxidant support is important because UV exposure,
hmm
pollution, inflammation, and environmental stress all contribute to free radical damage, but not every vitamin C is the same.
Exactly. Some forms are stronger and potentially more irritating or unstable,
Hmm.
while others are gentler and better tolerated. So, again, it comes back to client skin.
Hmm. For a resilient client with dullness and sun damage, a more active vitamin C could be really great for them. For someone with more rosacea prone skin, acne, or some barrier issues, you may need a gentler formula or a formula with salicylic acid. And vitamin C is not usually my only pigment corrector. I think of it as support. It helps protect, brighten, and defend. But for stubborn, pigment like melasma or PAH, I usually combine it with other pigment focused ingredients.
Yeah, I do too. And of course, sunscreen.
Right.
We cannot say that enough.
No, we can't.
All right. Azelaic acid deserves its own moment because it's such a great ingredient when acne and pigmentation are both present.
Hmm.
It can help with acne, inflammation, redness, PIH. It's one of those multitasking ingredients that makes so much sense for acne prone clients who are left with dark marks.
Yeah, I really love this ingredient and I think it's definitely underutilized because this is such a huge category for clients. They're not just dealing with those active breakouts, but they're dealing with the mark that stays for weeks or months after the breakout's gone. And azelaic acid can help calm that inflammation while supporting that more even tone.
Yeah, and I also like it. It can be really helpful for a wide range of skin types,
Hmm.
including, clients who maybe can't handle the harsher actives right away. But it can still cause dryness,
Hmm.
tingling, or irritation for some clients. So, really make sure that you're introducing it thoughtfully.
Hmm. Yeah, I wouldn't necessarily throw azelaic acid, a retinoid, benzoyl peroxide, exfoliating ingredients,
This
and
sounds
vitamin
lovely.
C as someone, maybe not all at once, someone. But I'm going to throw a few of those.
Yeah. I know, as much as I joke, I do agree. I would gradually introduce those because if they come back irritated, you don't know what caused it.
Yeah. And irritation can worsen that pigment.
Exactly. Yeah, which defeats the entire purpose, of course.
Yeah. Okay, Morgan. So let's talk about cysteamine because this is one of the newer pigment correction ingredients and it's gotten a lot more
A
attention.
lot of
And we
attention.
had a little experience with it a couple years ago.
We did. Yeah, cysteamine is really interesting. It works on multiple points involved in that pigment production. It can be super helpful for stubborn hyperpigmentation, including melasma.
Hmm.
It's not brand new scientifically, but in skincare and pigment protocols, it feels newer to a lot of estheticians and clients.
Yeah, and one thing people should know is that cysteamine products often have very specific instructions. Some are short contact products, meaning they're applied for a certain amount of time and then you wash it off. This is not an ingredient where you just say, okay, use it however you want.
Yeah, make sure you follow those product instructions and prepare the client for the fact that some of these products can have a very distinct smell.
Oh, yeah, we have to be honest about that. Because we were a little taken aback by
Yeah.
it. And if your client's not prepared, they might think something's wrong with the product or they won't stay committed to it.
Yeah, it smells like perm solution.
Yeah. This
Um,
this ingredient too has been around for a while. It started out in Europe and then I think just started coming to the US in the last so many years.
yeah. She's stinky, but she works.
She works.
Yeah, it can be a really useful option, especially for clients who need an alternative to hydroquinone
hmm
or who are working on stubborn pigmentation. Again, the big thing is don't overcomplicate the routine. If you're using cysteamine, build the routine around that. Don't stack every brightener in the cabinet on top of it.
Yeah, absolutely. So we've talked a lot about pigment inhibitors, but we also need to talk about turnover. Pigment inhibitors help reduce new pigment production, but existing pigment still needs to move up and out through the skin's natural renewal process.
Yeah, that's where retinoids and exfoliating acids come in. Retinoids help normalize cell turnover and support healthier skin function. They can be very helpful in pigment protocols, especially when used consistently and tolerated well. Exfoliating acids like glycolic, lactic, mandelic, and salicylic acid can also help support pigment improvement by encouraging that surface cell turnover.
But this is where estheticians can accidentally create problems because if you over exfoliate pigment prone skin, you can create that inflammation.
Mhm.
And inflammation can create more pigment. So the question is not how fast can I peel this pigment off? The question is going to be how do I support controlled turnover without creating more trauma?
Yeah, that's such a key point, especially for higher Fitzpatrick types and melasma prone clients. Mandelic acid can be a really nice option for some pigment prone and acne prone clients because it's generally a slower penetrating ingredient than glycolic acid.
hmm
But again, it depends on the formula and the client. And then with salicylic acid, I'm usually thinking acne, congestion, oil, and inflammation.
hmm
If acne is causing that PIH, salicylic acid can be a really valuable tool and part of that strategy.
hmm And then we also need to talk about some barrier support because pigment protocols can become active heavy super quickly. When the barrier is impaired, the skin is more reactive, more inflamed, and less tolerant of corrective ingredients. So, ingredients like ceramides, hyaluronic acid, panthenol, oat extract, allantoin, bisabolol, niacinamide, green tea, and resveratrol can all be really helpful.
Yeah, and sometimes the best thing you can do for a pigment client is not add another pigment inhibitor. It's repair the barrier so that they can tolerate the pigment inhibitors that they already have. Also, niacinamide deserves a quick mention because it can also support the barrier function while calming inflammation and supporting uneven tone. It
hmm
pairs really, really well in those pigment routines.
hmm Yeah, especially for clients who need brightening but also need some calming in there.
All right, let's make this practical. What are some ingredient combinations that work well together? One classic approach is a pigment inhibitor plus turnover support plus antioxidant plus sunscreen. For example, a client might use vitamin C and SPF in the morning and then a pigment inhibitor and a retinoid at night.
Or for acne prone PIH, you may think about azelaic acid, salicylic acid, niacinamide, and some barrier support.
And then for a melasma prone client, you may think tranexamic acid, niacinamide, a tyrosinase inhibitor, a retinoid, and a tinted SPF with iron oxides.
And then for sensitive pigment prone skin, you may start with some licorice root, niacinamide, a gentle vitamin C derivative, barrier repair, and then a strict sunscreen before adding on those stronger actives.
Yeah, and then if you have more resistant pigment under the direction of a medical provider, hydroquinone, that's going to be my gold standard there. That can be used in cycles with a maintenance plan after.
hmm The maintenance plan is kind of the part that people forget because once they have all that pigment lightened, they're like, okay, I'm good. And it's like, no, you got to keep going.
Always,
Yeah.
always. Clients clear the pigment and then they stop everything except for maybe a moisturizer. And then
Yep.
here comes summer and the pigment's back.
Yeah, exactly. So a good protocol has a correction phase and a maintenance phase. Correction is where we're actively working on that pigment, and then maintenance is where we're trying to prevent some relapse from happening.
All right, let's talk timelines. So pigment improvement, it takes time. For epidermal pigmentation, you may start to see visible improvement in as little as 8 to 12 weeks, as long as you're consistent with your home care and your SPF. But that deeper, that more stubborn pigmentation like melasma or long-standing PIH, that can take several months or even longer.
And the client's consistency matters. Are they using their products correctly and are they reapplying sunscreen? Are they avoiding heat triggers? Are they still picking? Or are they using random TikTok products in between visits?
Yeah, that last one. I also think we need to explain that pigment may look darker before it looks better in some situations,
Mhm.
especially as that pigment is moving up to the surface. Sometimes it just looks darker.
Yep. And photos are so helpful because clients look at their skin every day and they might not notice that gradual change. So, progress photos under consistent lighting are huge.
hmm
And I would rather under promise and over deliver than tell a client their melasma is going to be gone in 4 weeks.
Yeah, please don't promise that. So, if an esthetician is sitting with a pigment client, where should they start?
First, identify the type of pigment as best as you can within your scope. Is it PIH from acne? Is it some sun damage or melasma? Is it trauma induced? And is there redness or vascular involvement? Is it active or stable?
Yeah, and then identify the triggers. Are we looking at sun, heat, hormones, acne, picking, inflammation, medications or recent procedures, barrier damage, their lifestyle or occupation? Then assess the barrier because if the barrier is compromised, that may need to be corrected before you go into a full pigment protocol.
Yep. And then build the home care around four goals: protect, suppress, turn over, and repair. Protect with the SPF, invisible light protection, suppress with pigment inhibitors, turn over with retinoids and or exfoliating acids, repair with barrier supporting and anti-inflammatory ingredients, and keep it realistic. The routine does not have to be 12 products.
hmm
Sometimes a cleanser, antioxidant, pigment serum, moisturizer, SPF, and then a nighttime retinol can be enough.
Yeah, and if the client's not consistent, adding more products is not the answer.
Such a good point. A simple routine done consistently will be a complicated routine done twice a week.
Always. Yep. All right, let's give estheticians some wording that they can use with their clients.
Yeah, I love this.
All right, you could say pigment correction takes time because we're not just fading what you see on the surface, we're also trying to calm the signal that keeps telling your skin to make more pigment. Or you could say your brightening products are only half of the plan. Sunscreen is what is going to protect your progress.
I like that. Another one is with pigmentation, irritation can set us back. So we're going to build your routine in phases instead of starting everything all at once.
Yeah, I think that's perfect for clients who want everything immediately. And then for melasma, you could say melasma is managed, not cured.
Mhm.
Our goal is to improve the appearance and then reduce flare ups, but maintenance will be ongoing.
Yeah, I love that because it's honest and professional. And clients do really appreciate honesty. They may not love hearing that pigment takes time, but they do appreciate knowing what to expect.
Yeah, and just feel like as transparent as you can be, they're going to trust you so much more. They're going to be like,
Yeah,
hey, Julie told me it's going to take months.
yeah, absolutely.
All right, let's run through some common mistakes that estheticians make with pigment protocols. Number one being treating all the pigment the same. PAH from acne is not the same as melasma,
Hmm.
and melasma is not the same as sunspots.
Yeah. Number two is over exfoliating. That's going to damage the barrier.
Huge. Yep, that one's huge. And then number 3, not prioritizing your sunscreen.
If SPF isn't a part of the conversation, it's not going to be a pigment protocol.
Yeah, and don't be afraid to say like, I'm not comfortable doing this because you're not going to wear sunscreen.
Yeah.
All right, number 4, ignoring heat and visible light, especially when you're working with somebody with melasma.
Absolutely. I mean, if they're going to be outside and in the sun, like sunscreen, a hat, like those are non-negotiables.
Absolutely.
Number 5 is not supporting the barrier.
And number 6, promising unrealistic timelines.
Yep. Pigment is a long game. Okay, so time for your homework. This week, I want you to choose one pigment client or create a hypothetical client profile and then map out their pigment protocol using 4 categories: protect, suppress, turnover, and repair.
And then write down, what are you using for sun protection? What ingredient is helping suppress excess pigment production? What is supporting healthy turnover?
Mhm.
And what is keeping the barrier calm and resistant? And ask yourself one more question. What is the client's biggest pigment trigger?
I love that. Because if you don't know that trigger, your protocol is going to be incomplete. And then bonus homework, practice explaining pigment timelines to a client in 1 or 2 sentences. Keep it clear, honest, and easy to understand because client education is what creates buy-in.
Pigment correction is not about throwing every brightening ingredient at the skin. It's about understanding the pathway, choosing ingredients intentionally, protecting the skin daily, and setting realistic expectations.
Mhm. And when you understand how these ingredients work, you can build better protocols, explain your recommendations with more confidence, and avoid creating inflammation that makes pigment worse.
Thank you so much for listening to the Skin Instructors. We'll see you next week.
Make sure you're subscribed wherever you listen to your podcasts. We drop new episodes every Wednesday. And then follow us on Instagram at SD Training. We love hearing from you.
Yes, and make sure you head over to our website. It's www.sttraining.com to join our monthly subscription. We drop monthly education content, and as always, don't hesitate to educate.